How the pandemic has disrupted the social interactions and routines that are crucial for toddlers' speech development. The pandemic has been a challenging time for everyone, especially for young children who are still learning to communicate. Toddlers need frequent and meaningful social interactions with their parents, caregivers, siblings, and peers to develop their speech and language skills. They also need consistent and predictable routines that help them understand the world and express their needs and emotions. However, the pandemic has disrupted many of these opportunities for social learning and communication. Many families have been isolated at home, limiting their toddlers' exposure to different people and situations. Some toddlers have missed out on preschool, playdates, or visits to relatives and friends. Others have seen their parents or caregivers stressed, anxious, or depressed due to the health and economic impacts of the pandemic. These changes can affect the quality and quantity of language input that toddlers receive, as well as their motivation and confidence to communicate. The pandemic has also disrupted many of the routines that toddlers rely on to feel safe and secure. Toddlers thrive on structure and predictability, which help them learn new words and concepts, follow directions, and cope with transitions. However, the pandemic has forced many families to change their daily schedules, activities, and environments. Some toddlers have experienced disruptions in their sleep, eating, or play patterns. Others have faced new challenges such as wearing masks, social distancing, or online learning. These changes can cause confusion, frustration, or anxiety for toddlers, which can interfere with their speech and language development. In this section, we will talk about the signs of speech delay or disorder in toddlers and how to screen them at home. Speech delay or disorder means that a child has trouble understanding or expressing language. This can affect their ability to communicate with others and learn new words and skills. Some of the signs of speech delay or disorder in toddlers are: not responding when you call their name by 7 months to 1 year of age. Making only a few sounds or not using gestures like waving or pointing by 7 to 12 months of age. Not using at least 25 words by 2 years of age. Not using unique two-word phrases or noun-verb combinations by 2.5 years of age. Not using at least 200 words or not asking for things by name by 3 years of age. Being hard to understand even if you live with them by 3 years of age. Unable to say previously learned words at any age. Having trouble producing speech sounds correctly or stuttering when talking at any age. Having difficulty putting sounds and syllables together in the correct order to form words at any age. This may be a sign of apraxia of speech, a specific speech disorder. If you notice any of these signs in your toddler, you may want to screen them at home to see if they need further evaluation. Screening is a way of checking your child's speech and language skills and identifying any areas of concern. You can screen your toddler at home by using online tools, such as the Ages and Stages questionnaires, ASQ, external icon, which are designed for parents to complete with their children. The ASQ covers various aspects of development, including communication, and provides feedback on your child's strengths and needs. Another way to screen your toddler at home is to observe how they communicate with you and others in different situations. You can use the following questions as a guide. How often does your toddler initiate communication with you or others? How well does your toddler understand what you or others say? How many words does your toddler use and how often do they learn new words? How well does your toddler combine words into phrases or sentences? How clear is your toddler's speech and how easy is it to understand them? How fluent is your toddler's speech and how often do they stutter or repeat sounds or words? How appropriate is your toddler's speech and language for their age and context? If you have any concerns about your toddler's speech and language development after screening them at home, you should talk to your child's doctor or a speech-language pathologist. They can perform a more comprehensive assessment and provide diagnosis and treatment if needed. Early intervention is important for helping children with speech delay or disorder overcome their challenges and reach their full potential. The pandemic has been a challenging time for everyone, especially for young children who are learning to speak. Many children have missed out on opportunities to interact with other people, hear new words, and practice their speech skills. This can affect their communication and language development, as well as their social and emotional well-being. But don't worry, there are some effective strategies and activities that you can do at home to stimulate and support your toddler's speech development during the pandemic. Here are some of them. Talk to your child as much as possible. Narrate what you are doing, describe what you see, ask questions, and respond to their sounds and gestures. This will help them learn new words, grammar, and conversation skills. Read books with your child every day. Choose books that have colorful pictures, simple words, and repetitive phrases. Point to the pictures, name the objects, and encourage your child to join in. Reading books will expose your child to a rich vocabulary and stimulate their imagination. Sing songs and rhymes with your child. Music is a great way to enhance your child's speech and language skills.